budget cycle in Nigeria. The public spends a lot of time discussing the size of the budget, the revenue projections that undergird the budget, and how much has been allocated to specific sectors, to health, to education, to infrastructure, and other priorities of government and priorities of the citizens. And those conversations are very important. But what we must realize is that an approved budget is just the beginning. We spend a lot of time talking about when the budget was approved, the process through which it was approved, but it's just the beginning of the conversation. Because for citizens, public finances actually become much real later on in the chain. And this reality hits us when we walk into a primary healthcare center and their medicines are available. When a child walks into a classroom and there's a teacher that is actually there to teach, and the classroom itself has a roof, has a chair, has chairs, tables, and is conducive for learning. And it also becomes real when someone turns on a tap and water actually flows out of the tap. Or when a social protection payment for an internally displaced person, for example, reaches the person and can be used to provide basic services for a displaced family. That is the last mile that we are talking about. And so between that budget approval and what a citizen eventually experiences in terms of services delivered, a lot has to happen. So funds actually have to become available, right? Procurement has to take place. Projects and programs have to be implemented, and facilities need to be stocked with people providing the services, with equipment and other supplies. And also, we have to be able to account for whether these resources actually achieve what they were intended to achieve. And that is why Pulse is really important, because the ideas at the heart of Pulse are very simple. Approval doesn't necessarily mean that releases will be made. The fact that releases are made, that's budgetary releases, does not necessarily mean that those funds will be spent. And even when funds are spent, it doesn't mean that services are automatically delivered. Now, I've been talking about Pulse. I'm sure you're like, what does she mean by Pulse? Is she a medical doctor? No, I'm not. Now, Pulse is an acronym that stands for Public Finance Unlocking Last Mile Services. And the summit that we're holding on the 3rd of September will be held under the theme From Approved Budgets to the Last Mile, examining budget implementation in Nigeria. And so what we want to do at Pulse is to connect all the different parts of the public finance conversation that are often discussed separately. So, I've talked about revenues, I've talked about budgets, releases, procurement, service delivery. There's also an audit and accountability component to this discussion. And they're not separate. We tend to talk about them separately, but they're all parts of one chain that eventually results in the delivery of services on the other end. So we might have a program in an approved budget, but then the funding comes late. Or the funds may be made available, but then because procurement doesn't happen when it should, how it should, it delays implementation. And then even when a project has been completed, we have to ask ourselves, is the service actually functioning for the people who depend on those services? So when we don't have service delivery at the last mile, when something is not working, the school is not properly equipped, the primary healthcare center does not have medicines, doctors, nurses, the answer is not always simply that there was no budget. The challenge may be planning, it could be release, it could have to do with procurement, implementation, oversight. It could be a combination of all of these, right, in different ways. And if we don't understand where the problem actually occurred, we can't dimension the problem properly, it's actually harder to identify the right solution to ensure that citizens are getting services.